Hmm. Ron, you even mentioned in your book your own experience with a patient that came in debilitating with back pain, and I think it was radiating into the leg. And your use of that illustration was to identify that not everyone needs the same treatment. I think you initially attempted extension or a backward bending movement, which is common for people with that kind of condition, and
Sure.
yet he was actually worsened, and you had to go a different direction. Do you care to just talk about that a little bit so people get an idea of some of the illustrations that are used in the book?
Sure. Well, I mean, directional preference is more widely acknowledged, but most people have an extension directional preference,
Hmm.
but not everybody. And so, because so many do, then some people who don't, some clinicians who don't fully understand MDT will extend everybody and will help a lot of people. But there's people that don't respond to extension, but they will respond to a lateral movement. That's the next largest directional subgroup. And of course, the smallest one are those that respond to flexion
Hmm.
and have what we used to call anterior derangements. And so uh, every patient needs to be tested to determine whether they have a directional preference and what direction that preference is, because that then opens the door to identifying the effective treatment at eliminating the pain. And so there are patients that extension will not help them. In fact, it aggravates them, but yet they very readily respond to either a lateral movements, test movements, or to flexion test movements. And so that's one of the differences between a well-trained therapist in MDT and one that only knows about extension. Which, if you're only going to learn one direction, that's the direction to learn, because that's the bulk of the patients. But yet there are a lot of folks that unfortunately don't recover because they're not fully tested.
Hmm. You mentioned several myths that are out there. We've talked about a few of them already. What are some of those more common myths that you address in the book? And maybe what are the ones that are most predominant, maybe, or maybe the most challenging to kind of convert people to be at least entertaining the thought of.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.